are you? I'm fine. Thanks, Amir. Very good. So today we are here at the Model 42 Meetup in Dubai. So is this your first time here in Dubai? No, it's not my first time in Dubai. I have different projects here before. So okay. So what brings you to Dubai in Model 42 this time? And also introduce yourself to our audience. Thank you. So, my name is Alexander Karasev. I'm a doctor of medicine and I'm practicing laboratory different medicine approaches, bring new methods from science to clinical practice, and enjoy science, biomed fields also. So today I'm here to make pitch deck and to make a discussion how we can definitely take care of us for the more longevity ages. So, what it is longevity and what it is active lifestyle. It is suitable for us to take some medications, take some supplements, go to fitness and sleep well. So, is there a it we can do in 21st century or not? So that is the question we're here to discuss. So what are the answers that has come about in today's session? So we find out that all the medicine, all the medical approaches brings us only 13% in lifespan. The 13% is so expectations was much bigger than. And person in what terms? Like in lifetime expectancy only. So like that, if a human is born, yes, and all the medicine is fine, and the insurance system goes on, and all the doctors and nurses bring the brand new methods to this organism. So only 13% of age we can increase, and there is the ceiling. That's all. And our question is, what the technologies we can use to increase the lifespan radically? I want to live more. I want to live longer. But with this 13%, is it that people have increased their age from what number to 60 to 70 or 80, or what is the number that has up till now we have increased? So the previous century, we saw that lifespan can be increased dramatically from 14 to 16, 17. So it's okay. It's a very huge approach was done with child infections because we have the antibiotics right now and we know how they introduced, how we can care about infectious patients. It's okay. We have a vaccines that brings us brand new shield with the virus infection that we could overcome the century before. So what's next? What's nowadays? We have a brand new technology. We saw that different techniques should be assessed to new fields of aging. So we know that there is an intercellular matrix. It's some space which can be healed by itself, and our aims should be there. Another way is personal approach, where we can cure all patients like copy of once. No, we have the personal approach in different fields, and if we saw on oncology, we have a brand new targeted therapy drugs. They completely cures, for example, melanoma. A century ago, we know that this cancer is just bring human to death. No way. But now we have a targeted therapy, just drug pill that stops completely the growth of this tumor. Yeah, that's interesting. Could we find some drugs that has such a targeted approach to different other illness? No, I mean, of course, during the coronavirus, we learned that pneumonia or, these kind of simple kind of diseases 100 years ago back in Spain, people died so much. And, with this corona, despite it was so, unexpected and people had no idea about it, and yet a lot of lives not just were saved, but were also being, kind increased. So we understand that yes, there is an element of longevity that we see it in different scenarios. But what I have heard and learned from here is that you are with Model 42. You are bringing basically longevity as a field of age technology. It is something. So tell us more about in a simplistic way as you may now. Okay. But I can understand the complexities is also important. But just right now, for like generally, what is it that age technology field? What is this field coming up?
So, as I mentioned, the personal approach, the first one. The next, we're trying to calculate in numbers what the approach bring us how many years. And if we think in such way, we can easily calculate how much even different technologies bring us. And in that way, the next step, we just create a table of different approaches and pick up the best ones. Surprisingly or not, the first one is food, sleep, and our environmental conditions. Everyone can speed up his death because of smoking. So we know it's just not the news, but what the approach to bring this information carefully to patient for active doing active stopping while smoking. What we have to do is some mental or psychological instruments we have to help. The next one is the fitness. So physical activity brings us a healthier state. We have an open questions. How different people here, from childhood to oldest man in the world, could be easily fit in fitness. So, what amount of physical activity, what the amount of some iron he could held up is the question. So, uh, an answer is the numbers.
Right.
5 days a week.
Yeah.
Everyone should go walking in a maximum speed, for example, when they breathe just normal when he, it's the best way.
But you're talking then away, but now you're getting into the field of lifestyle. You're getting
Yes.
into the process of people's, attribution, people's personality, people's that. So that is, again, we understand that.
Yes, it's a simple way.
Yeah.
What's
But
next?
lifestyle, again, I mean, there's a better things as well that you don't live it all your life, so why not enjoy it as the most that you can? So there is different personality traits. What is it that we want to know in terms of quality that can also improve? Because if you are increasing the number of years, yes, how much the quality is getting improved, and on top of that, how much good that person could able to bring in the world as well.
Yes, you absolutely clear that lifestyle modifications is very actionable, but not usable by each of us. So it's why, but no. What's next? So it's the laboratory medicine. So it's a pathology which may measure each biomarker, for example, in your blood or different liquids. So and what's next? So we have these numbers and calculate by the artificial intelligence, by the different mathematical models, how this marker affects your lifespan. So, if it's very important marker, you should carefully impact on that. So, it could be drugs, it could be supplements, could be right food, could be targeted approach to lifestyle and fitness, especially. So all these should be carefully driven when we pick up primary information about everyone, calculating what approach should be fit rest of you, and then not remember about mind state. So, what is psychological state? What about psychiatric problems many of us have? And if the antidepressants should be magic pill. Now, it's the complex approach of different, as you know, the different fields combining together is very interesting to find out that and to combine in different balanced manner for each of us. I think this is the revolutionary approach, and artificial intelligence bring us the new instrument to find this data very fast and very accurate.
Right. I mean, obviously, there is a field which is still growing and is still coming up now, like technologically speaking. Although, like you said, for the past 1,000 years, we are trying to keep them better and better just to develop. Uh, before we sign off here, tell us our audience and who are mostly UA of Alpha, please. Uh, what is the level of for a business person or a investor? Yes. Is there any money in this type of account?
Yes, the IMF field is very interesting for investors. So they try to use their conventional instruments to achieve the financial plan of that company, to find if that company goes well or will going just manner. So the interesting of things of investors, how they carefully pick up the projects with grown not only financially but intellectually. So the intellectual property of different company is the is that potential that investors invest right now. And this IP is not simply to understand.
Right.
Our goal is to translate from language of science, medicine, new technologies, or different informational approaches to simple language of investors. Right. But this is the rules, not sales, rules, how we can pick and your investor pick the right projects to look on. So it is the probability. The investments is like, as you know, but we have to calculate all these gambling models and bring investors the plan and instruments and their role to use these instruments in different projects.
Well, we will keep on track with you on that going forward. And we hope to have more conversations with you, maybe in other places of Portugal or on webinars or perhaps here back in Dubai. Well, guys, thank you so much for listening and hope you enjoyed today's conversation about the age tech, the emerging technology that is just coming up now in Dubai. Thank you so much.
Thank you. Keep safe.